Hello everyone, I am Dr. Yasir Rizvi. I am working as a senior consultant in nephrology at Dharamshila Narayana Super Speciality Hospital, Delhi. Today I shall be talking to you about kidney diseases. First, we should know what are the function of kidneys. So as you know, every one of us has two kidneys, and these two kidneys are located in the abdomen. The function of kidneys is to filter out all the toxins which are produced during the various metabolic processes in the body, and it helps in fluid regulation. So any excess fluid that you have in your body is filtered out. Then there are certain electrolytes like sodium, potassium, magnesium, calcium and phosphate, the levels of which are maintained within normal range by kidneys. Then kidneys also help in regulating the acidity in your blood, because a normal pH is required for a normal biochemical functioning of your body. Then being an organ, kidney also helps in regulating your blood pressure, and it also produces important hormones like erythropoietin. This helps in building up hemoglobin in your RBCs, which increases the oxygen carrying capacity of the blood. And it also helps in producing activated form of vitamin D3, which is very important for health of your bones. And next, we want to know what are the symptoms of kidney disease. So it is important to understand that in the initial part of kidney disease, the symptoms may be so mild that the patients may not actually be aware that he is having some kidney problem. But as the kidney disease advances, patients can have symptoms like decrease in appetite, repeated vomiting. They may notice some swelling, especially around their eyes or near their ankles. This is more prominent especially in the evening time. Then as the kidney disease progresses, patients can have a decrease in urine output. Some patients may even notice some changes in their urine, like they can have a red colored urine, which we call as hematuria, or they may have difficulty in passing urine, or there may be some burning sensation while they are passing urine. So as the kidney disease progresses and it becomes more advanced, patients can have symptoms like breathing difficulties, or they can even have drowsiness, and even in extreme cases, patient can have seizures. What are the most common causes of kidney diseases? So when we talk about kidney diseases, there are certain diseases which predispose to kidney dysfunction. So the most important of which are diabetes, hypertension, or if a patient has renal stones or recurrent urinary tract infections. There are certain kidney diseases which are called as glomerular diseases. So these can be seen in diseases like lupus nephritis, membranous nephropathy, focal segmental glomerulosclerosis. Then there are certain diseases which are hereditary. That means they can be passed on from the parents to the children. So these are some of the common causes of kidney disease which you should be aware of. How do you detect a patient who has a kidney disease? So there are some very simple tests that can be done that can pick up kidney disease at an early stage. The most important is a regular blood pressure checking. If a patient is detected to have a high blood pressure, then he should get tested for kidney disease. Then there are certain blood tests that can be done to pick up these kidney diseases. So we do kidney function test that includes urea and creatinine, which is checked in your blood sample. If these levels are raised, they indicate that the kidneys are functioning less. Then we can also do a urine examination. So in a urine examination, if it is found that the patient is having protein excretion in urine, any RBCs or WBCs in urine, then they should be investigated for kidney disease. And if there is a strong suspicion for kidney disease, we also do an ultrasound examination, so that can tell us if there is any stone or any obstruction in the kidney disease. And it can even detect presence of any cysts, which indicate a hereditary form of kidney disease. And next question is, who should get tested for kidney disease? So ideally, any patient who has diabetes, hypertension, those who are overweight or those who have obesity, or any patients who are on regular use of painkillers like Brufen or Voveron, or patients who have cardiac disease, they should ideally get tested for kidney disease by doing regular blood test and urine test. Ideally, they should be done once in 3 months or as recommended by your physician.